Hey everyone, this is Dr. Zachary here, Performance Sport and Spine. In today's video, we're going to talk about 7 evidence-based tips with dealing with acute low back pain. So this video is intended for educational purposes only. It is not medical advice. If you're suffering from low back pain, you should always go seek out care from a trained healthcare provider. We're going to define pain anywhere from the inferior margins of your ribs to the superior crease of your glutes. And there should be no major trauma or medical disease that causes this kind of back pain. So tip number 1, if you have no leg pain or symptoms, it's extremely unlikely that you have a slipped disc or a pinched nerve. Now those are kind of misnomers, but basically if the nerve is getting compressed or irritated by the disc, you would have pain down your leg or weakness. So if the pain is associated to just your back, you can be extremely confident that it's not a pinched nerve or a slipped disc. So tip number 2, this pain is going to be super severe and acute, and it may even take your breath away or feel debilitating. You're going to have to slow things down and don't feel guilty. You got to let tissues calm down and then increase activity as your symptoms allow. A good analogy here is an ankle sprain. If you sprain your ankle a lot, it's going to hurt. But you're not going to lay in bed for 2 weeks. You're just going to rest it, and then each day as it heals, you're going to use it a little more. The same applies for the low back. So the third tip is pain often doesn't mean damage. So again, we don't want to be fearful to use our back as if we're wearing it out. Pain is just saying to go slow and proceed with caution. So tip number 4, scans may not provide any answers. Only 1% of all low back pain is caused from serious pathology such as fractures, infections, or malignancies. And if you look at these papers right here, there's tons of people that are asymptomatic, that have no back pain, that have structural changes to their spine. So tip number 5, there's no magic bullet or exercise or stretch that's going to fix low back pain. Fortunately, the prognosis is good. Between 4 and 6 weeks, 70% of people will feel better kind of on their own. Now, reoccurrences are pretty common. So don't spend your time trying to find this core activation or this special stretch. Find things that you enjoy and then dosage them appropriately. Do this kind of step approach where each week you kind of do a little more than the previous week rather than doing nothing, ramping up super hard, flaring up for a week, waiting 2 weeks, and then repeating that cycle. Tip number 6, this is not going to be a linear prognosis. You're going to have some good days and some bad days. So you wish your prognosis was going to look like this, but it's probably going to look more like this. So again, think of flare-ups as just traffic jams. You're still getting where you want to be, just a little slower. So sleep, diet, and hydration. Now these are 3 areas that can help with pain. So if there are any of them that are kind of lacking in your life, working on getting them better will probably help reduce your pain to some degree. Thank you so much for watching our video on acute low back pain. We hope these tips give you a little help. It's a really frustrating and painful condition, but luckily it does get better with time, and hopefully this gives you some reassurance.